slow. I was gonna answer slow.
I'm gonna set the mood. That's what I meant. I mean, that's a strange question. Like, why do dogs age so quickly? Like, well, other than tortoises and all animals kind of age quickly, right?
Yeah. I'm just gonna have to give a roundabout answer.
Why do dogs age super magic fast?
Yeah, it's their only flaw.
It's their only flaw. That and not being, toilet trained. I feel like my dog could figure out the toilet, though.
Oh, my dog, but it's great because my slightly bigger dog can drink out of the toilet, but I don't want my little diabetic one to drink too much. So it's actually, isn't it terrible? I leave the toilet. But it's a toilet nobody uses, so it's
fine. Who cares? It's the same as a tap water.
Well, they lick each other's butts. I didn't think it was that big of a deal.
Okay, so I have an idea for a Google Home commercial that actually happened. Where I was letting my dog lick my mouth, which I always do. And my boyfriend made a comment about how he had just seen her lick her butt. And I hadn't. Like, obviously that messes with your head. And I said, like, dogs' mouths are cleaner than human mouths. And he goes, are they? And I'm like, of course they are. There's some kind of enzyme or something. They're cleaner. And I'm letting her lick my mouth. And then I'm like, I don't actually know. And I said, hey, Google, are dogs' mouths cleaner than humans' mouths? And as she's licking my mouth, she's like, that's a common misconception. Dogs' mouths are not cleaner. Their tongues merely have more ridges so they can clean out a wound or a cut faster. And like, Google's telling me this as she's licking my mouth. And I just like slowly put the dog away. And I thought, that's a good commercial.
That's perfect.
Right?
Oh, yeah, that's awesome.
Like, hey, Google, are dogs' mouths cleaner? Yeah. No, just.
Well, then you cut to the surveillance video of the dog licking the bowl.
Well, and look, honestly, I still kiss her every day. But it's like in that moment, because he had just said that she had licked her butt, I was like, I was making peace with him. I'm like, hey, Google. No?
That's awesome.
I know. Google really knows how to shame me.
We haven't moved that way yet to Alexa or Home.
Got to do it. Do the Google Home. I got it for doing a show, so I didn't pay for it. I don't know if I'd want to pay for it. But Siri's a joke, but Google Home is for weather, for alarms, for music especially.
Yeah, that's what I wanted.
Because I don't even ask for something. I say play relaxing music.
Play Girls, remember your positions. Remember to cheat forward.
I'm cheating. I'm slow. I know my questions. We're gonna nail it.
Good. Here we go. And action.
We love our dogs so much, but unfortunately, it seems that they just never.
30 times the charm.
Here we go. And
now I'm gonna blow it.
Action.
We love our dogs so much, but unfortunately, it seems like they never live as long as we want them to. Why does it seem that pets age quickly?
To answer that question fully, you'd have to go back to the science and the genetics of really, what causes aging to begin with. But we know smaller dogs will age a little bit slower. Larger dogs tend to age a little bit faster. And of course, it's very species different.
I'm so sorry, but your hair is off. Hold on.
Mine?
Yeah.
So basically just, don't be silly.
I want to talk about telomeres and stuff, but...
I want to talk about a telomere.
Let's go back to your line. Start from your line.
Mine?
Yeah.
Okay.
Antioxidants, guys.
Here we go.
Yeah.
Keep our cells alive.
Here we go. Quiet and set, and action. From the top again.
Okay, from the top.
We love our pets so much, and I know one thing that most of us feel is that they just never live as long as we want them to. Why does it seem like, dogs have such shorter lives, or why they age so quickly?
It's their one flaw, right? Their one flaw is that they don't live as long as we do. And to really get down to the science of it, we'd have to be talking about the genetics of aging. But we know that smaller dogs are going to live a little bit longer. The larger dogs tend to age a little bit faster. But of course, that's very species different.
Are there certain things that you can allocate to, certain species, like certain things that dogs may have in common about how they age or different ailments they may have, things that are really prone to, dogs or cats specifically?
The best thing that I can tell you about that is that it's very breed specific. So certain breeds have certain tendencies depending on how their bodies are put together. And obviously there's much more variation for that in animals than there are in humans. But the best quote that I ever read is that genetics load the gun and the environment fires it.
So you know that an animal may have a predisposition to have a certain ailment, but also you want to make sure they're in the best environment possible to create the best quality of life and the longest life possible.
Right, yeah, exactly. Yeah.
So I'm curious, what is an example of something that would be specific to a certain breed, just for any viewers that may not know something like that?
Well, let's take the brachycephalic breeds, for example. So
Say
those are
what?
the brachycephalic breeds. So these are the ones that have the smushed in face,
Oh.
the pugs or the English bulldogs or the Boston Terriers, which I have too. But they tend to have what we call chondrodystrophic, where their bones are just put together a little bit differently. Sometimes you'll see them walking around, like that. The elbows will stick out, their shoulders will stick out. But of course, because their bodies are put together differently, they are predisposed to maybe bone injuries or arthritis, early onset. So those are things that we look for.
And I know especially with little dogs, it can happen when they're jumping on or off couches or beds. And I'm one of those homes where I'll stub my toe constantly on all the different stairs that are pushed up against a couch or a bed, because we want to be so careful to make sure that we don't aggravate, especially bones or pain, especially as a dog ages. What are some other things, other than obviously building a stairway for your animal, that we give to dogs that may be in pain, or ways that we treat certain ailments now?
Yeah, absolutely. But besides just changing the environment and making sure that things are flowing properly, that they can get to their water bowl properly. Generally, in veterinary medicine, we will, as soon as we see the arthritis setting in, we will prescribe things like NSAIDs, so nonsteroidal anti-inflammatories. Even gabapentin is a very common drug that actually acts at the neurological level to really stop the brain from interpreting the pain. And then, of course, as we age even more, we have things like morphine and some of those other really high level pain medicines that in reality are very much of a silver bullet. They are very strong. A lot of them even have blood work that we take in order to make sure that the organs are functioning properly before we prescribe them.
So I heard you mention NSAIDs, non-steroidal anti-inflammatories.
Yes.
And so that's the kind of thing that we would take as people, to reduce inflammation, correct?
Right.
And you said gabapentin,
Yes.
which is based in the neurological system. I actually know that that's usually prescribed in humans as a anti-seizure medication.
Yes. And even in dogs as well.
Yes. So these are pretty, strong drugs that we're talking about here that, of course, if needed, are totally wonderful. But what maybe are some side effects or some downsides of giving an animal this, maybe when they might not quite need it?
Right. There are a lot of downsides to a lot of the medications we use. And if we just look at NSAIDs, which is one of the more common classes of drugs that we use for pain in general, if we don't have proper liver, kidney, or even GI function, we can cause ulcers. We can irritate potentially an ulcer that's already there if we have a particularly nervous pet to begin with. There are other little things. Even if we had early onset of kidney disease that maybe we hadn't seen yet, we have to make sure that those organs are functioning properly before we prescribe that medicine.
Because it's something that's pretty strong.
It is, and it can push a pet over the edge,
So now that we're talking about things that might be a little bit too extreme for a pet when we're trying to solve a problem, I've been hearing a lot about CBDs as a wonderful alternative to these medications or these drug options. So tell me, what are CBDs and why am I hearing about them, especially in reference to pet care?
Yep, absolutely. So CBDs, it is nothing but simply a part of a plant that has been grown for generations. We know that this plant has many different medicinal purposes. Even part of it that gets brought up a lot is THC, which causes hallucinogenic things, and also has different medicinal purposes. But for this reason, the CBD has been found to have the best effects that we have that we can use in medicine right now.
So you mentioned THC. That's not what this is. That's something totally different.
Completely different.
And they just happen to come from the same, plant, same. You mentioned THC, and that's something totally different. That happens to come from the same family, but it's a totally different member of the family. And this is a CBD. You said something that we know is going to have the positive effects on an animal. What kind of?
I'm so sorry, you went out the door, so can you just go back?
Yeah, totally.
Yeah, check your notes too. By the way, is that working for you guys with the recording? We doing okay over there?
Yeah, we're doing okay. It looks really good. Just
Yeah, and feel free at this point where you're picking up to really drill down on CBD.
But without saying any of the other words.
you can say
I don't want to, no marijuana, no cannabis.
No marijuana, no cannabis. Hemp is fine. And then clarifying it's not THC. Yeah.
That's right, yeah, just, yeah, anything, but or if you want, right now, you can just say marijuana, like, you have to get it out of your system.
I don't want to get out of my system. I just think it's the pink elephant that is best to put the leash on so people know that we acknowledge it and it's not it.
But I don't want to say it.
I understand. You're the boss.
No, I'm not.
You are the boss. Well, someone else other than me is the boss.
So nice, thank you.
Okay, Leanna is the boss, so I'm not the boss.
But let's drill down on that, all right?
Yes, sir.
Okay? But other than that, it's fantastic.
We're nailing it, I think.
Dribbled water.
And like I said, let's drill down on the CBD part of this.
Yep.
And this is a short break, correct?
This is just, well, I mean, I hope
What?
everybody will get started in 30
I don't know. I dribbled water on my face, did I?
Keep rolling.
And by the way,
We're still rolling, guys.
by changing the way we're recording this too, we've got a lot more freedom on what we're doing. That was a rhetorical question. Okay. All right, thanks. That was my fault.
I like those shoes, Mitch. I do like those shoes.
Well, you know, I'm a shoe guy.
Yeah, they're sharp.
I'll take you shoe shopping.
Shh, can't afford it.
I bet you look good in a pair of Louboutins.
Okay, guys.
I didn't know you were a shoe man for women.
This thing.
Dani, fantastic. Fantastic.
Okay,
Yeah,
but Leanne,
nailing
is this
it.
a thing?
So,
Is this that thing?
are we recording?
Okay.
Here we go. We're rolling.
Asphalt.
Quiet on set.
You're kissing. You're kicking asphalt.
You were making this easy.
Okay. So you mentioned that there are things like the NSAIDs and gabapentin, and a great, safer, more gentle alternative is CBDs. So tell me a little about CBDs and why I'm hearing so much about them, especially with pet care.
Yeah, it's very interesting. You know, in veterinary medicine, we're taught that sometimes we jump to the end, you know, of the amount of medicine that's available to us. So there's a lot of times when a pet will come in with the end stage arthritis or end stage, you know, terminal illnesses, and we immediately go to the medicine that really causes a lot of. Let me rephrase that.
Yeah, sure. Well, actually, because I think it would be just as a cool idea for you to have a decent outline of where to go and how much you do or don't have to say. What are CBDs? They're a cool, safe alternative in terms of not being as aggressive. And then I think we can mention how they don't make you high, it's not THC, this or that. And then I think it'd be really good to talk about why it's nice to do it before the end, that fact
Right.
you said about the 18 months. Yeah.
Let me say this
Right.
again, and I want you to play more of an expert, so it's not that you're naive about it, Natasha. So your questions are well thought out.
Okay.
You're being an expert on CBD, and again, you know, the highlights as we go through what we're going to do is it's non-narcotic. It's, you know, there's a benefit of it that it is natural. You know, those kind of things that many times when people come into a veterinarian's office, in the case of my dog, he was on tramadol, Rivera, gabapentin. The first, you know, sort of reaction was heavily medicated with prescription drugs and narcotics.
Right.
This is
Okay.
natural. So,
Okay.
but play it more as being the expert.
Yeah. I think talking about the natural, but then I would love the idea of us going into what we were mentioning earlier today of alternative medicine and why we look at that differently, and then how, all that.
Take away and run with it.
But I was just letting her know so she didn't worry about having to answer everything in one answer.
She
Yeah.
had a camera in the dressing room. But go ahead.
No, trust me, we would have gone into a lot of brick walls. Okay.
Quiet on set. And action.
So I know that you've mentioned these different drugs that dogs are taking when they are ailing or aging, and what those downsides can be and those negative side effects. I keep hearing about CBDs, and I want to know why CBDs are becoming so popular, especially with pets.
Yeah.
How are these better than the drugs we just were talking about?
So a lot of times we go right to the end of the line, you know, but there is an opportunity for us to back up a little bit and find these very, very safe, very natural alternatives that really don't have a lot of downsides.
Right.
You know, we talked about the downsides already, but there are alternatives like CBD that provide so many benefits with honestly none of the downside.
And what are some of the benefits of CBDs? Like what exactly would it be able to help a dog with, whether the dog is hurting or aging or even end-of-life care?
There are so many. I mean, it started at the top, antibacterial. There's even one, the properties of it that help with relieving gut stasis. So when the gut doesn't move properly, especially pain, anxiety, I could go on and on and on, you know, but it's applicable for so many diseases that we've come across.
Well, my dog was given CBDs for anxiety, and it was a very long process. I like to, liken it to sometimes when someone might have a skin issue, and it can be kind of frustrating as a person because your skin can't speak back to you and tell you why it's inflamed or why it's red, and that can be sometimes frustrating. It feels like that sometimes with a dog when they're exhibiting a behavior and they can't tell you why.
Right.
So we went through several different foods and anti-allergy situations until we realized it's anxiety. So then you come to the point, do you give them a medication? Do you give them the Xanax or the whatever it is?
Yeah.
Or do you try something like CBD? And it was a miracle worker for me. And I didn't even know that it had the other medical benefits that you're mentioning. For me, it was purely just for her quality of life. And when you're saying that there are anti-inflammatory benefits as well, I mean, that you give dogs drugs just particularly for an anti-inflammatory purpose, right?
And to your point with the skin, inflammation causes so many problems in the body. And inflammation can even cause the problem of pain that is associated with arthritis, for example.
Right.
And even within my practice, 70% of our patients come in being over 70 pounds. And of course, they have arthritis. That's the number one thing that they're complaining about with their pets. So for us to have a safe alternative that we could put them on, particularly when we're in hospice care and we don't want to irritate any, any impending condition that is existing, and we don't really want it to get it too bad too fast, it's such a good alternative for us to use.
I love that you just used the word alternative.
Yeah.
Because I think there's this phrase, alternative medicine, that some people say we just kind of have it backwards, where there are phrases about this is alternative medicine, or this herb, or maybe this, something that is actually from the earth is the alternative medicine to the lab-grown medication that is chemically based, right?
Yeah. I'm sure doctors, thousands of years ago would be laughing at us
Yes.
saying alternative medicine because it's almost an oxymoron.
Right.
Meaning they're both medicine. And even if you look at chemotherapy drugs are still derivative of plants. And we administer those in particular order, in a particular way that has us treat something in the body that has gone wrong.
So one can be a medicine that we can take not only just to cure some of these issues that you've been mentioning, but even as a preventative medicine, and maybe the other stuff is the alternative.
Yeah.
Right?
Yeah, and going back to something that you said, I really want to harp on this. The anxiety component is so important in veterinary medicine. And one of my mentors, I took a class from her a long time ago, Dr. Temple Grandin, she said that anxiety is worse than pain in animals. And if you look at that, think about your pet being in pain. Think about if you stepped on her toe, versus if you have a dog that doesn't want to go into a veterinary clinic. Or I'm from Florida, thunderstorm anxiety. I have seen dogs in crates pull out their teeth because they want to get out of a crate during a thunderstorm. There's so much anxiety that comes into that.
You worked with Temple Grandin. You took a class from her.
I took a class. I wish I worked.
You're so impressive. You never cease to amaze me. So the anxiety, it really does need to be talked about, because that may not even be an issue that a dog would naturally have, but maybe they have it when you're moving, when you're traveling, or when they go to get groomed. Yeah. I am guilty of trying to groom my dog on my own on several occasions because of her anxiety. So yeah. CBD is something that maybe you could administer to a dog, if not on an ongoing basis, but could you try it even for a day or two?
Oh, absolutely. It isn't something like a non-steroidal anti-inflammatory that when I administer that or when I prescribe that, I tell the families, this is something that we can't stop. And gabapentin is another example. We can't stop this. We're going to lose the effect that we gain if we cease to use this medicine.
So now that I know all the ways that it can really change the life of not just a pet, but the pet owner, I would like to know, we know it's plant-based, we know that it's natural. How do we find CBDs? Where do we get CBDs? And do humans use them too? Right,
yep. So CBDs, which are just cannabinoids, they are a derivative of a plant. And some of them are hemp plants. There are many different plants out there that are in a particular class that produce this compound. Of course, THC is part of that as well, and that has a lot of psychotropic effects, but also medicinal effects that luckily human medicine has really grasped that very well.
Right. So when you mentioned, you said hemp and cannabinoids, people I think sometimes may think of what THC would be, but you're speaking about a completely different component of that family that has nothing to do with any animal feeling some kind of high or altered state of mind.
Right,
is that right?
Psychotropic, effect. No, absolutely not. Because cannabinoids are really the main benefit that we see in veterinary medicine right now.
Oh, wow. So I know that they're totally legal in all 50 states, which, by the way, even having some of these medicines we mentioned earlier, you couldn't just buy gabapentin from online. That wouldn't be illegal. That would be under a certain class of a drug restriction, correct?
Right.
Whereas you're looking at CBDs, and that's even more legal, more safe
Right.
than these other drugs we may be giving the dogs.
It's not a scheduled medicine.
Right,
To be doing.
right.
It's not scheduled.
So it is legal. There's no chance of any, because I know some people might, question if anything new, how is it going to affect my dog? No dog is going to feel any kind of high or any effect like that. Totally safe. We're just talking pain management, anxiety management, and maybe even, like you mentioned, the antibacterials and the gut health and all of those other wonderful side effects that are all positive.
Just even and what I say when I tell families this, it's maintaining the homeostasis of the body, and that's
Wow.
really what that is. So the ECS, or the endocannabinoid system, which within the oh, hang on a second, it's endo something or other.
I think that was it, endocannabinoid
really
system.
oh dang it was
Yeah,
okay.
yeah.
I really want to make sure I got that right. Okay. Okay. So really what it is maintaining the homeostasis of the body. So the endocannabinoid system of the body maintains a normal state. And it's in all vertebrates, so all vertebrates have this system. And it helps keep, like I mentioned before, the gut working properly, the inflammation down, even something like insulin. So my own dog was just diagnosed with diabetes, and I've started her on a CBD product because I want her to hopefully maintain that level without me having to give too much insulin too quickly.
So I'm sorry if this is going to be a little bit too, broken down, just so I want to make sure that I'm understanding everything. So I know what an endocrine system is. An endo just means it's in our body,
Endo
right?
means within,
Okay.
Endogenous. Yeah.
So I think we've probably heard of an endocrine system. So you're saying we have another system that's within our body that's called an endocannabinoid system that we all naturally have if we have a vertebrae. So this is a
Yes.
lot of beings on this planet.
Many of Earth's beings have this system, yes.
So when we say that we have all of these different abilities to be affected by something like this, it's very common, everyone has it, but are we naturally kind of, are we not paying enough attention to it? Do you think that we could be solving more ailments and problems if we paid more attention to our endocannabinoid system?
Absolutely, yep. And if you think of the ECS as maybe this main system within the body that helps regulate everything, right? Making sure everything works properly. But a lot of our medicines that we have, we'll try to treat this way of inflammation, with an NSAID. We'll try to treat this way of inflammation with gabapentin. We'll try to treat this way of inflammation with another medication. But being able to go and treat the root cause or the root source of homeostasis is such a powerful thing for us in medicine to be able to do.
Just not putting a Band-Aid on something.
Right.
And instead of putting the Band-Aid on something, especially something that maybe an animal can't tell us exactly what's going on, we're saying, let's get to the root of the problem. Let's stop or at least decrease the inflammation before it starts or as it's starting. And especially if there is a problem already that we're aware of, let's see if we can treat that without potentially adding in these other ailments. So this actually brings me to something I want to ask you about. When is the right time to start a dog on any kind of health or monitoring system, not just looking at their food, but really paying attention to their health and their well-being? When's a good time to do that? And do people maybe avoid it until sometimes it's too late?
Yeah, it's so interesting because people will tell me all the time, well, animals can't talk to you. They can't tell you what's wrong. But I said, no, they do. They really do. If you know your pet's personality better than anybody. It's my job to know the medicine, and it's my job to know the disease. But for owners to really feel empowered to watch your pet, their normal process of life. Are they eating more slowly? Are they eating more quickly? Are they having 10 seconds more to get in the car than they normally do? So if you really pay attention, you will hear them and what they're saying. And any change is something that is worthwhile to bring up to your veterinarian in order to look into.
Yes. So I know my dog, I can always tell if she's uncomfortable just by the way her tail is, the shape of her tail. And I've tried to, look at things online and read books and watch videos online to try to learn, how do I figure out exactly where, any pain could be on an animal? And sometimes an easier choice is just to say, I know that I can help you feel better in a safe and non-invasive way. And it's really a gift that you give to an animal. Instead of me trying to become as smart as you are, I think that this is something that every person can at least try to do, is help an animal like this.
And even if you see your pet taking a little bit longer to move around, or maybe you're worried about some mobility issues or something like that, there is something called a diagnosis of exclusion. So meaning if you see these things happening, but you know that you can't replicate this in the veterinary clinic, either A, take a video so you remember, B, so that your veterinarian can see, and C, if you end up adding something like a CBD product, which is over the counter, something that's very easy to obtain, you can look back on the change that is in your pet and see if something really did evolve. So then you can, in a sense, diagnose a pain or discomfort simply by the fact that it's not there anymore when you add in some type of supplement or medicine.
You said earlier that with animals, anxiety is worse than pain.
Yeah.
So I know a lot of people say that stress is something that's very, hard on the human body.
Yes.
And so many times when we have different ailments, maybe if we try to eliminate stressors from our lives, we can actually do ourselves a medical service as well. And so do you think it's the same with animals? Trying to eliminate that anxiety is a nice place to at least start before we try to solve the other issues?
It really is. I feel so blessed to be a veterinarian. I really do, because animals are so pure in their intentions. They're so pure in their spirit. They're pure in their actions. So it's not like us where, if you're put in an uncomfortable situation, you're like, I'm just going to fake it. I'm just going to make it through. Animals don't really do that. Like, they are very open with us in what's going on. So for us to attempt to move out a stressor, it's something that we can do. But sometimes we can't, of course.
Right.
Particularly in, like I said, Florida with thunderstorms, there's nothing we can do. But there's different ways to mitigate the interpretation of that stress.
Stress, yes.
So that they feel better throughout it.
I just like to hold my dog very closely during a thunderstorm. That's
Right.
so
Is that for you or for her?
both. So I want to move to a kind of similar topic, but about why CBDs I think are really wonderful, and that is the financial benefit.
Right.
Because you told me a fact today that I couldn't believe, and that's that how long is the average time between the time that a pet owner comes in and decides that they're ready to administer, euthanasia, and that's the right choice?
Right, right.
And how long has it been since they've been to the vet?
It's this fascinating thing. So we dove into hundreds of clinics in their data, and we wanted to look at this, particularly, again, in what I do, hospice and euthanasia care. So many of the families that I talked to during that moment, that last moment, they have not been to the veterinarian in quite a long time. So we found that over 70% of both dogs and cats that are geriatric have not been to the veterinarian within 18 months of that euthanasia.
Why do you think that is?
There's many different reasons, and even just me talking to families and being with them in that last moment, there are 100 different reasons on why. But the most common reasons I hear are something to the effect of they're not going to be able to do anything anyway, or they're going to talk me into hundreds of dollars worth of diagnosis, and the diagnostics aren't going to give me anything. They're just going to give us answers, but are they going to give us treatment?
So we already know that the average pet owner, up to 70% of pet owners, has something in common, or at least two things in common. And one is they don't want to spend so much money, even though they love their pet so much, they know how expensive it is. And another thing they have in common is not always feeling like they can trust in care to solve a problem ongoing and knowing that that is going to be the fix. We know people have those two things in common. And bringing in something like CBD, not only may you have the ability to extend that time much longer, and not seeing a problem progress, but also for a much potentially cheaper cost.
Yeah, absolutely. Yeah, and I know that the pet owners, particularly people that love their pets as family, so I should rephrase that as pet parents.
Thank you.
Right,
Thank
exactly. It's not really about the money, but it is whether or not the money is going to give us answers. And I always tell the people, diagnostics give us answers, and answers may or may not actually lead to a different treatment. But if there's a treatment that we can give without having to have answers beforehand and with no downside to it, could that potentially be a better way, a less financially expensive way, a less expensive emotional way as well?
Right. So in terms of having to continue something ongoing and how that can be a financial expense, what happens if you decide to stop taking the CBDs? If you stop administering them to your pet, is there going to be an immediate response to that? Is there going to be, because for financial reasons, maybe someone feels like they don't want to start a medication that they can't continue ongoing. Can you start? Can you stop? Is that safe?
There's no downside again to stopping or starting. If somebody asked me, what would happen if I went off this, I would say the same thing that was happening before you gave them, most likely. So it's not like we get this, this build-up residual effect so much as just almost like with any medication, when we're giving it, we're going to see an effect, and when we remove it, we may have those symptoms return again.
Got it.
Fantastic. That's great. We got you all got it.
Look at that.
So what we're gonna do right now is we're gonna take a break.